emergency ambulance? Is the patient breathing?
I'm not sure.
Emergency ambulance, tell me exactly what's happened.
She's broken her ankle, the bone's through the ankle.
We need an emergency ambulance.
At the heart of the major trauma system is the London Ambulance Tactical Operations Centre.
New incident details received.
A taxi has crashed into a lamppost, and then bystanders have pulled the person out of the car unconscious. So what we need to do is get some pain relief and then have a look at your leg.
Working together, you've achieved so much for Londoners this year. You're making London Ambulance Service a much better organisation to thrive in. And you can see this from our staff survey results. Not only did more people contribute than any other organisation in London, but we also showed record improvements across all of the people-promised domains. From reducing our response times, increasing the number of patients we're able to care for on the telephone, being awarded the National Ambulance Resilience Contract, named as a top 5 apprentice provider in the country, introducing teams-based working across the organisation, increasing our 111 footprint and working with GPs to get patients the care they need more quickly, and investing in our fleet. This is a long list of improvements. I know it's not perfect yet, but when you watch this, I hope you will see just how far we have come and feel rightly proud. And no one can tell that story like you do. So in this video, it's over to members of our team to show what we're really proud of.
In the last year, we massively reduced 999 call answering time from 64 seconds to an average of 12 seconds after hiring more call handlers.
We have improved our average Category 1 response by 39 seconds and our Category 2 response by 9 minutes.
Over the last year, we have implemented the clinical dispatch support model within the control room that sees us co-locating a multidisciplinary clinical team into our control room, and that really enables us to send the right resource to the right patient in the right time frame.
We also flag calls to our clinical advisors that are appropriate for hear and treat, and these patients might benefit more from being treated within the community and alternative care pathways.
For the end of July, our hear and treat rate was 20%, so that made us the highest ambulance service with the highest hear and treat rate in England.
Earlier this year, the London Ambulance Service was awarded the National Ambulance Resilience Unit contract. This means we ensure that all staff across the Ambulance Trust in England are trained with the appropriate skills to respond to a major incident. That includes our hazardous area response teams.
I originally joined in December 2022 as an assistant ambulance practitioner. I found the education team absolutely fantastic. They were really supportive throughout my journey as an AAP and now a technician. I still get support from them now, even on the road. I feel fully supported throughout my apprenticeship. I know that if I need help, I know where to go, and I also have a fantastic crewmate to support me as well. Since joining as an AAP, I have upskilled to a technician. I'm currently a trainee emergency medical technician with the London Ambulance Service. And I absolutely love my job, and I'm so glad that I found the apprenticeship route, as I think that is better suited to me as an individual and better fits my learning style.
I've been with the service for 15 months now, so I'm actually an international from Nigeria. I also stepped into the role for the African lead for International Staff Network here at LAS in order for us to be able to help the African International in LAS.
So over the last year, we've made a concerted effort to attract and recruit people from ethnic minority communities. So we have a workforce that better reflects the richness and diversity of the populations that we serve in London. And at the end of 2023-24, we recruited over 500 people from ethnic minority and black communities, which was equivalent to 38% of all of our new starters.
I've been working for London Ambulance Service for over 7 years now. Moving to London is a massive step, but London's newly qualified paramedic program is so supportive. I've done and accomplished so much in London. This includes secondments such as the Fast Response Unit, working for the Mental Health Joint Response Car, and working in the clinical hub advising on calls. I've undertaken my master's degree in primary and urgent care, and this has led me to working in my current role as a specialist paramedic in primary care.
This year we've introduced team-based working to 911 operations, and what's most important for me and what's benefited my staff the most, I would say, has been the introduction of the 1 to 15 teams and the huddles that are happening in EOC. The result of that means that each performance manager can take more time to deal with staff welfare concerns and any pressing issues.
Over the last 3 years, we've invested well over £40 million in new vehicles by replacing old, ageing DCAs, double crew ambulances and cars with new fuel-efficient electric or hybrid vehicles. Over the coming years, we will turn our attention to updating our operational estate, and in 24-25 we've begun this journey, and we're investing £25 million in 3 new facilities in North East London.
We have been working collaboratively with our partners across London, pioneering approaches such as a new agreement with hospitals and integrated care systems across the capital to hand over patient care at the emergency departments within a maximum of 45 minutes.
London Ambulance Service have partnered with East Merchant PCN to carry out a pilot in a pioneering call answering model to help tackle the 8 AM rush for GP appointments. We have a separate team of call handlers in our Barking call centre where calls from the practice are diverted through to our call centre for any patient who has a same-day need for healthcare. This is helping the practice answering their phone calls between 8 AM and 1 PM, which is the peak time for same-day healthcare calls. The service has shown a much faster call answering time, and we're also able to book patients into the right part of the system. This is also showing increased patient satisfaction scores and a much happier practice reception team.
We are really proud to answer 111 calls for patients across every borough in London. In the last year, we've been successfully awarded contracts for North West London and North Central London, and continue to develop network partners and strengthen our role as an inclusive and innovative provider of urgent care across the capital.
This year we launched the London Heart Starters campaign, which is fundraising to ensure there are an additional 200 public access defibrillators in unlocked cabinets where they're needed the most. Our campaign used data to identify defib deserts, small communities across the capital that have little or no defibrillators available to help save a life. We're working with communities to identify defibrillator guardians, install public access defibrillators and ensure communities are trained in CPR and using a defibrillator. Our mission is to train a generation of school children, and so far we have managed to train over 10,000 in CPR and defibrillation. Our work will help improve cardiac arrest survival rates in the capital.
This has been just a flavour of what we've achieved this year, and there's lots more we could have covered. And all of these achievements mean we've made an excellent start in delivering on the 3 missions we set out in our strategy. To deliver outstanding emergency and urgent care whenever and wherever needed. To be increasingly inclusive, well-led and highly skilled organisation that people are proud to work for. And using our unique pan-London position to contribute to improving the health of the capital. So thank you for everything that you all do every hour of every day. That means we put our values of caring, respect and teamwork at the heart of all we do for Londoners as the capital's emergency and urgent care responders.
If her breathing changes in any way, will you please call us back at 909?
Emergency ambulance, is the patient breathing?
She passed out and now she's just gone very limp and cold. So...
Okay, my dear. Is she breathing at the moment?
No, I don't think she is.
She's not breathing, okay.
2, 3, 4.
1, 2, 3, 4. 1, 2, 3, 4. Keep going, my darling.
It's just all about now.
Alright, Sue, we're nearly going to be with you, okay, my love?